Hey guys, Shauna here again. So, one thing I've been wondering about and seeing the start of repercussions of that I think we all have is the economics of what's going to happen, as well as the long range recovery. Um, the economics, I think we all agree, is devastating across the board, regardless of sector. Whether it's travel, hospitality, everyone who's been forced to work from home. Even in healthcare, we're seeing this. People are just trying to avoid coming into any place that's public, including a clinic. And I don't blame them. So it's certainly impacted us. I talked in my last video about how it's impacted the way I do healthcare. But the other thing I worry about that hasn't been touched on or haven't seen anyone touch on yet is what's going to happen once we're in the position to recover. So what I mean by that is, say, best case scenario, miracle happens, COVID's wiped out, we get a vaccine, we just develop immunity, something happens and we start to recover. What is that recovery period going to be like? And so, for example, from the healthcare perspective, all non-essential healthcare services are just being deferred. So, for example, 6-month follow-up ultrasound for following what's likely a benign growth, sleep studies, Holter monitor tests, non-essential urgent referrals to specialists. All of these things right now are being declined and deferred. So, flash forward to September, when, ideal case scenario, COVID is a bad dream and a distant memory, and we start to recover. So how do we recover? Do we start just running extended hours, running 12 to 18-hour days at our healthcare facilities, at our labs, our diagnostic imaging centers to catch up? Do we recruit more healthcare professionals, physicians, nurses, lab techs, radiology techs? How will we deal with the resurgence? I think that's something we need to start thinking about and planning for in parallel with how we manage this pandemic. So just some things I'm thinking about. Happy to hear some thoughts, for some discussion. I don't even know if these videos will ever make it to the light of day, to be honest. Just looking for an outlet for thoughts and discussion and things, conversations I'm having with my physician colleagues in between patients and across messaging services. So just wanting to let you know where my head's at. So happy to hear comments, questions, concerns, and discussions. Till next time.